Well, good day, and welcome to the Motivation edition of 5 Minute Psych. In this 5-minute segment, we'll explore our motive of sex. We'll begin by looking at some reasons why we have sex before examining the physiology of the sexual response. Then we'll consider factors that influence our sex drive, before ending with a discussion about sexual orientation and why some of us are attracted to people of the same sex. You could live your whole life and never have sex, but you wouldn't last very long without food, water, or sleep. So why do we need to have sex then? Yes, of course we do it to reproduce, survival of the species and all that, but that can't be all of it, because we have a lot of sex without wanting to conceive. Also, if it was just about reproducing, then why would people masturbate, use birth control, have oral sex, or have sex into old age? One obvious answer to why people have sex is to give and receive sensual pleasure, and this could be just in the physical sense, as in desire to have an orgasm, or it could be used in a deeper way to express love and intimacy with our partner. Sometimes people have sex because it helps them attain a goal, like not having to pass the entrance exam or making someone else jealous. Others view it as part of their duty in a committed relationship, because if it were up to them, one study found that roughly 20% of women and 10% of men would rather not have sex. And finally, one study asked sexually active teens why they were having sex, and they said it was because they felt pressured by their peers to do so. All their friends were doing it, or they thought it would make the other person like them more. Masters and Johnson studied the physiology of the sexual response in the 1950s by observing male and female prostitutes as they masturbated to orgasm. In doing so, they found 4 phases in the sexual response. First, in the excitement phase, blood flow increases to the genitals, and males get an erection, while females experience lubrication of the vagina. Then there's the plateau phase, where blood flow increases more and other physiological changes become more pronounced, like an increase in heart rate and breathing. The third phase is orgasm, which constitutes a series of rhythmic contractions. In males, these contractions project semen out of the penis, while in females, these contractions happen in the uterus, vagina, and surrounding muscles. Finally, there's the resolution phase, where physiological arousal returns to normal. During this phase, males enter a refractory period where for a brief time they wouldn't be able to have another orgasm, while females may experience more orgasms here. Obviously, the sexual response can vary enormously across individuals and even within the same individual over time. Many factors influence our sex drive. Physiologically, we know that having a baseline level of androgens is necessary to maintain sexual desire, because without these male hormones present, someone's sex drive will just gradually disappear. But we also know that there's a big psychological side to sex, because in some people, just getting lost in a sexual fantasy is enough to trigger orgasm. On the flip side, sometimes things in our head can have a negative influence on sexual desire. Things like stress, fatigue, or even worrying about how good the sex will be can stop things in their tracks. Finally, being exposed to erotic stimuli can cause sexual arousal, as long as it's perceived as erotic by the viewer and doesn't cause negative feelings. Someone's sexual orientation refers to their preference for having a sexual relationship with a partner of the same or opposite sex. Not too long ago, we thought that people were either one way or the other. But today, we know that sexual orientation is on a continuum, from strictly heterosexual at one end to strictly homosexual at the other extreme, and smack dab in the middle would be someone who is bisexual. So how common is homosexuality in the population? Well, it's difficult to estimate, because what has to happen to count as homosexual? What if you tried it in college but never did it again? Does that count? What if you never did it, but every time you had sex, you fantasized about someone of the same sex? Does that count? If we go by how many of us are attracted to others of the same sex, regardless of our sexual behavior, then roughly 1 in 10 of us is considered homosexual. So what causes some of us to be homosexual? Well, we know from twin studies that there's a genetic component to it, because identical twins are much more similar in sexual orientation than fraternal twins. But it can't be perfectly genetic, because even identical twins don't match up all the time with respect to sexual orientation. Further inspection suggests that the prenatal environment could play a role, affecting one twin and not the other, and we'll have to leave it up to future work to investigate that. Well, we just explored our motive of sex by starting with some reasons why we have sex before examining the physiology of the sexual response. Then we examined factors that influence our sex drive before ending with a discussion about sexual orientation and why some of us are attracted to people of the same sex. Now, aren't you glad you had 5 minutes?